We are here this afternoon for a Facebook Live chat with Westfield Regional Health Department Director Megan Avallone. Thank you, Megan, for joining us.
Thank you, Amy. Pleasure to be here.
Good. All right. Today we're going to talk about the COVID-19 booster and some other vaccinations that people may or may not want to get this fall and winter season. But let's first focus on the science behind the need for this year's COVID shots and how it's different from previous shots.
Yeah, so we're seeing a shift in the way we look at COVID vaccines this year as opposed to previous years. This year, what we're seeing is the FDA and CDC are saying that COVID shots should really be looked at like flu shots, meaning that they're going to be annual shots. So this year, we're calling this year's COVID shot the 23-24 COVID shot, and it was really developed to protect against the strains that are currently circulating and that we expect to circulate later in the season, just like flu shots do.
Okay. So who's currently eligible to receive the COVID booster shots in our municipality?
Yeah, so currently anybody who's 6 months and older who's interested in a COVID shot can get one as long as it's been 2 months or longer since they've last had a COVID vaccine.
Mm-hmm. So do you have any recommendations for what age people should get a COVID shot?
So the general recommendation is individuals 6 months and older should get a shot. But remember, right, this is general guidance. We always refer individuals back to their healthcare provider to really find out what the best individualized plan of action is for them.
All right. So if you have any questions, ask your physician.
For sure.
Okay, great. So are there side effects that have been reported from this 23-24 COVID shot? And are they different than any of the initial vaccine doses, any of the side effects we saw with those?
Yeah, so the three most common reported side effects for the 23-24 formulation was number one, the most common was localized pain or discomfort at the injection site, which would be like a sore arm. The second most common was fatigue, feeling tired the day before, and then followed by headache. A complete list of side effects can also be found on the manufacturer's fact sheet. Obviously, those are just the three most common ones.
One of the things that my office does for the City of Summit is communications, and we look at social media. And we've seen on social media that there are some reported side effects that seem very extreme. Have you seen any extreme side effects to the shots that are out there?
I have not personally seen extreme side effects, right? But fainting is one that happens rarely, but that can happen with any, medical procedure vaccine. People get really nervous. Very, very rarely there can be heart infections, very rarely. And then sometimes we have a drop in blood pressure, again, very, very rarely as well.
Okay, so these are reported by few and far between.
Correct. And the other thing with any vaccine too is if an individual is allergic to any component of any vaccine, just like anything that an individual might ingest, right? There's always the very, very small risk of allergic reaction, right? But what's important to note particularly about the allergic reaction is anybody that's doing the vaccinations are trained specifically with how to deal with that and how to counteract that. And again, those are very, very rare.
Got it. Great. So what's different this year about this shot, and how does it differ from previous years?
Well, like I said before, it's different this year primarily because we're changing really to an annual flu shot as opposed to a booster, right? So this is going to be an annual shot moving forward. But the big difference that residents are going to notice is this year's vaccine is not federally funded. So what that means is the past few years we've seen a lot of free pop-up clinics, if you will. The health department and other providers have been in the community and we've been giving vaccine away for free to whoever was interested in receiving it. This year, it's going to be rolled out very similar to how residents get a flu shot. So that's either through your primary health care provider, or through a pharmacy or through a food store, wherever you get a flu shot, that's where you'll be able to get a COVID shot this year as well.
Okay, great. So you are offering free vaccinations to any residents who's not insured or underinsured?
Yes, so just like we do every year for flu, any resident who is non-insured or underinsured can contact the health department for a flu shot and a COVID shot free of charge. So what that means for the residents of Summit is any resident in Summit should be able to obtain the vaccine either covered by their insurance, or if they're non-insured, or if their insurance coverage does not cover the cost of vaccines, then free through us.
Okay.
And we also provide homebound visits too for flu vaccine for sure, and possibly COVID as well.
Okay, great. We'll make sure we share that information on our website and social media pages. We just received a question from Jay Michael, who wants to know why people are dying suddenly. He wants us to ask you.
I have not heard of any studies saying that people are dying suddenly, so I would say that we did sit through the FDA and the Immunization Action Coalition hearings, and there was not data reported showing that residents or anybody is dying. What was the word? Dying rapidly?
Suddenly.
Suddenly, yeah, I did not see that.
Okay. But we'll look into it and see if that comes up for us. So how do eligible residents sign up for a COVID shot this year?
Right. So this year we are going to be allowing, or offering, I should say, a variety of clinics for non-insured, for underinsured, and also for little kids as well. As soon as we get the vaccine in our receipt, those vaccine clinics will be posted online. And as you guys know, we love to do those little infographics with the information on there as well. So residents should look for them on the website and through the city's social media platforms.
And we'll also stick it on our website as well. Okay, will COVID shots become an annual necessity like a flu shot? I think you touched on this briefly in the beginning, but can you tell us more about it? Will they be combined as one, or will you have to get separate shots? How will that work?
Yeah. Well, I think the technology is really hoping that down the road they will be combined as one, but they will also probably be individual formulations as well. Here's the thing about COVID, right? It's not going away. Unfortunately, it seems like it's here to stay. And just like other respiratory illnesses, in the fall and winter months, we're probably expecting to see spikes. So I definitely anticipate, and the FDA and CDC agrees, that moving forward during this time of year, residents will be, offered annual vaccinations.
Okay. So how do we protect ourselves? I'm starting to see more people, different places with masks, and what's your advice for people on how to stay safe?
This is great. It's been a long few years, and I think it's great to really get back to basics, right? So vaccination is a part of keeping you healthy, but it's not the only way, right? So it's really important that people stay home when they're sick. If your children are sick, right, really keep them home. If you feel like you might have COVID, test early, right? The government just released another round of over-the-counter test kits that individuals can receive directly, free of charge. And there is absolutely nothing wrong with wearing a mask, either to protect yourself or, if you are not feeling well, to protect others, especially if you're in crowded places. And then also washing your hands, right? I can't stress this enough. You should really be washing your hands with soap and water when you get home, before you eat, after using the restroom, and then sanitizer in between. Especially for little kids, it's really important to teach them proper hand washing as well.
Okay. All right, great. And some of those tips we'll continue to post and share. All right, let's focus on flu shots for a minute. With the ongoing pandemic, how important is it for residents to get their flu shots this year?
Yeah, so just as important as every year, right? We recommend a flu shot for everybody 6 months and above. Annual flu vaccines, while they don't protect 100%, they really, study after study shows that they reduce the risk of illness between 40 to 60%, right? So, and they definitely prevent hospitalizations. Flu is really serious. And during the pandemic, we heard a lot about COVID, but flu, people die from, lots of people die from flu annually as well. So especially for those that are, seniors, it's important for them to get a flu shot as well.
Mm-hmm. Great. So I've heard, they don't always get the right strain. So should I even bother getting a flu shot?
Right. So it is true that every year we do a best guess on what strains are circulating. And some years it's a good match. Some years it's not the best match. But here's the thing, right? It kind of jumps your immunity. So even if it's not a great match, it's still going to offer some form of protection. And there's still a great chance that if you are vaccinated, you'll be better off than if you were unvaccinated.
Okay, great. So if I consulted my private physician and I'm set to get a flu shot and a COVID booster, can I get them both on the same day? How does that work?
Yeah. So the guidance is you can get them both the same day. However, if there's any question for an individual and what's best for them, they should always reach out to their doctor to discuss the best plan of action for individuals specifically. But the guidance does say it's completely fine to give both the COVID and flu shot at the same day. What we generally say as a general recommendation is if it's kind of a hassle to get to wherever you're going to get one, and you don't think you'll be able to go back to that place, then consider getting them the same day if your doctor's okay with it. But if you can easily go back to the location where you are offered vaccines, then it's fine to wait as well.
Okay. All right, great. Do you have a recommendation for when we should get these shots? Like, should I go now? Should I wait a bit? Like, is there a rule of thumb there?
The thinking of this has changed a little bit. So now what the CDC says is as soon as they're available, and if it's convenient, if you're at a spot where it's convenient to get and it's available, then you should consider getting. Again, if you have specific questions about timing and what the best timing is for you personally, reach out to your doctor and discuss it with your doctor.
Okay, good advice. So where can I get my flu shot?
So the flu shots are being offered the same ways that they always have been for the last few years, which is great, right? There's lots of availability here. So it's going to be your doctor's office. Pharmacies are offering them. Food stores are offering them. Some urgent centers may be offering them as well. Vaccine.gov will give you a full listing of where to get them. And if residents have any questions on where to get vaccines, they can always call the health department and we can give you a listing of providers as well.
Great. So let's talk about people who are particularly at risk. Who should prioritize getting their flu shots?
So what we generally say is, respiratory illnesses, really the people most at risk are those very young, those older than 65, and those with compromised immune systems. Residents who are concerned that they might be more at risk should definitely reach out to their provider. But generally speaking, those are the individuals that we see most at risk for respiratory illnesses.
Okay, so let's just jump back to COVID for a moment because we have a question from Kathy. She would like to know, what is the best strategy to find a Moderna booster vaccine? I have had no luck even finding a place to receive it.
Yeah, the rollout of the vaccines, now that it's not under one direction, is a little wonky lately. What I would tell Kathy is give it another week. But if Kathy or any resident, right, is still having trouble, call our office. We on our website, we also have a listing of local pharmacies that have the vaccine, but we didn't ask them what brand they're carrying. But if anybody, the health department, we're here as a resource for residents, right? And these are the types of things we're gladly able to help residents with. So if any resident is having trouble finding a product that they're desirous of, feel free to send us an email or call us, and we'll definitely do the legwork for you.
Okay, that's great. And following this chat, we'll post your phone number for the Westfield Regional Health Department and any other relevant contact information in the comments on this thread.
Fantastic.
All right. So back to the flu. How is the municipal health department planning on raising awareness about the importance of flu shots this year?
Yeah, so doing things like this, right? Talking to residents, being available to residents, right? Any residents that have any difficulty getting vaccinated, any residents that maybe are homebound, that need a home visit, residents with any questions, really just to reiterate, we're here as a resource to help support residents however we can.
Okay, great. All right. So beyond COVID-19 and the flu, are there any other vaccines that residents should be aware of or consider getting, especially during these times?
So there is a newly developed RSV vaccine. So the RSV vaccine is new. It is available in New Jersey currently. And what the FDA has said is expectant moms and those over 60 should discuss with their healthcare provider to see if these vaccines are right for them personally. RSV is a virus that causes illness and hospitalizations in the community, primarily in those over 65 and under 5. So again, we're talking about, seniors and really those that are young. One thing, just going back to your previous question about, some things we do to raise awareness. We have 2 campaigns that start next month, which is a few days from now, October. I can't even believe it. So what we would like to say, what you'll see in our rollout next week is a Be Seen by Halloween. And the idea is it's kind of easy to remember, right? And we, individuals, residents that would like to get a flu shot, we really encourage that flu shot to be taken before Halloween to offer best protection through those winter months. And the other is Fight the Flu, right? Which talks about how you can protect yourself against the flu and with other measures too, like we talked about, the hand washing, the staying home when you're sick, all of that as well.
Mm-hmm. Yeah, they're catchy. Be Seen by Halloween and Fight the Flu. It starts with you.
Yeah.
Yeah, people can remember them, hopefully. Right. So I hear a lot about RSV. What does RSV stand for? Like, what does that?
So it stands for respiratory syncytial virus, right? So it's a virus that again really attacks the most vulnerable. You may have remembered last year they called it the triple-demic, I think. The triple-demic, I think was the word, where it was high cases of flu, high cases of COVID, and high cases of RSV. Because kids under 5 don't have proper protection naturally against RSV, they're more likely to be hospitalized, and then over 65 too. So that's why we're concerned about those age groups.
The old and the young.
Yes.
Okay. So how do routine vaccinations like measles or whooping cough play into our community's overall health, especially amidst the pandemic?
Yeah, well, it was really interesting to see during the early days of COVID, when there's no immunity in a population, just how quickly a pathogen can spread person to person, right? We're lucky in the U.S. we don't see these types of viruses because we do have vaccines which, really give us herd immunity. And I think it's important to remember that vaccinating, yourself really protects others as well, not just yourself, so that we don't have recurrence of these really, harmful viruses and bacteria.
Mm-hmm. That's great. What steps are you taking as a municipal health department to ensure that vaccines are easily accessible to residents regardless of socioeconomic status? You briefly touched on this, but can you elaborate a little more for us?
So anybody that is non-insured or underinsured will be able to get a vaccine free of charge through us. We'll most likely be out in the communities as well, because I know sometimes it's a hardship for individuals to travel to the Westfield office, so we do plan on doing pop-up clinics as well. We also plan on doing some pediatric clinics free of charge also. And, I just want to encourage residents that if anybody has any difficulty obtaining vaccine, call us and we'll find a way to really help them obtain what they're looking for.
Okay, great. How are vaccine hesitancy and misinformation being addressed at a municipal level?
So we sometimes get questions, right, about, the safety of vaccines and about what is right for an individual person. We always encourage residents that if they really have questions about whether a vaccine is right for them individually, they reach out to their healthcare provider. Okay. But also, we're here as a resource, right? So we do a lot of giving residents information from accurate sources to review, right? And we really help residents find information that is accurate so they can make the best decision for themselves.
Great. So you talk about accurate sources. What are some that you use to get information and would recommend that we look at?
Yeah, so I use the CDC website. I use the FDA website. The vaccine manufacturers as well. Those are like the go-tos for us that have easy to understand, accurate information. I caution residents to ask, people on social media what their thoughts are, and without talking to their healthcare provider also.
Okay. What other ways can we stay informed about the latest vaccine recommendations and any potential changes or guidance that are issued?
Yeah, I think our website and the city website, anything new that comes out, we post there, CDC website as well. We've been trying the last few months to really make information kind of fun to look at and more concise and really hit the high points for residents. So we'll continue to do that as well in the upcoming months.
Okay, great. How can residents support the efforts of the municipal health department in promoting vaccinations and overall public health?
Yeah, so it goes back to, just what I talked about before, right? We would so love it if residents, could wash hands more frequently, stay home when they're sick. There's no shame in wearing a mask. I'm about to start wearing a mask again when I go food shopping and things like that. I have young kids and I just don't want to bring anything home to them, especially, it doesn't have to be COVID, right? Like even the flu or anything else, it's that icky time of year. And then also, we also have distributed at the Summit Free Library free over-the-counter COVID test kits as well. So any resident who is interested can go pick them up there. We are asking individuals that if you do feel as though you're sick and it might be COVID, please test early.
Okay. If you test early and it's negative and you still continue feeling sick, do you recommend testing a second time, and after how many days?
Yeah, we do, especially if you've been exposed. So what we say is, if you test and it's negative, but you still feel lousy and you think it might be COVID, test again 48 hours later.
Okay, great. Well, we asked all of the questions that have been presented. There are a couple of statements that you can go back and look at,
Sure.
At later and go over. Do you have any more questions for Megan? Megan? No. Is there anything else you'd like to say or focus on?
Well, thanks for allowing me to be here today, and thanks to the residents. You guys have really done your part, so it's been a pleasure to be a part of this community the last few years.
Mm-hmm. Well, thank you, Megan. We enjoyed having you here.
All right, thanks.